Good day, everyone. My name is Chidima Chidoka, and I am your host and moderator for today. Thank you for making time to address an issue that demands urgent attention. We're talking about the escalating violence against women in our country. Despite ongoing efforts and advocacy, the reality on ground reflects a persistent and in some cases worsening threat to women's safety. That's what we're here to talk about. From ritual killings to domestic violence, the statistics are deeply concerning, and we're going to share some of them today. The personal stories are even more harrowing. So, what are we here today? We're here to bring awareness to the widespread nature of violence against women. We're here to discuss practical steps and strategies for women's empowerment. And we're here to see how are the different ways that women can collaborate. We're going to engage men, we're going to engage community leaders, and we're going to engage agencies to see how we can foster meaningful dialogue. We will explore root causes, hopefully, of gender-based violence. We will identify policy, and we will look at the interventions that are available. I'm happy to welcome our panelists today. They are all eminent women in the field. When I looked on the other on the webinar, some people said, "I'm your sister. I am your sister in the struggle," and where this is a joint effort, and I hope that with all of our efforts, we can push the needle even closer to where we want to be. At this point, I would like the panelists to, I'll give each of the panelists 2 minutes to introduce themselves and talk about what they do. Dr. Olasi, please, you can start. Dr. Olasi, please go ahead.
All right, thank you very much. My name is Dr. Ebele Olasi, and I'm here representing my amiable chief executive, the Director General of the National Agency for the Prohibition of Trafficking in Persons, NAPTIP, Athena Adamu Bello, who is unavoidably absent. She would have been here, but she's unavoidably absent. So I am Director of Intelligence, Training and Manpower Development, NAPTIP, and I'm here to represent my Chief Executive, Haja Binta Adamu Bello, OON. Thank you.
Thank you, Dr. Olasi. Welcome.
Thank you very much.
Is Professor Chaluchi here?
I'm here. Hello, everyone.
Hello, Prof.
Hello. It's a pleasure to be here. Thank you very much, Athena Centre, for having me. My name is Chaluchi Melukwe. I am a professor of law at Babcock University and as well as managing partner at Health Ethics and Law Consulting. But I think I'll be speaking most from my experience as Executive Director at CHELD, Center for Health Ethics, Law and Development, where we do extensive work on violence against women and girls and what people like to call gender-based violence. Um, I think, like our host, Mrs. Chidoka just said, this is obviously a very critical issue. And with all that has happened since this year started, um, I think it's brilliant that Athena is doing this and bringing together a wide variety of actors in the space to speak about this. So thank you very much for having me, and I look forward to the conversation.
Okay. We're also supposed to have a representative from the Ministry of Women. Okay, before we go there, can we have um, ACP Olusheyi Olabisi to introduce herself?
Is she muted, perhaps?
Yeah, yeah. It looks like she's muted. Let me ask them to.
My name is Assistant Commissioner of Police Olusheyola Bisi Okuwobi. I'm the National Coordinator for Police Campaign Against Cultism and Other Vices. This is a wonderful topic to be discussed, and I think I won't say it's long overdue. It's something that we should be discussing every time. We can't overflog the issue because the issue on our hands, it's something that is being overflogged by the perpetrators of domestic violence and people who try to relegate the female folks. So I'm really happy to be here this evening to discuss this issue.
Yeah, thank you, ACP. I'm really looking forward to our conversations today. Um, the representative from Women Affairs Ministry is the rep from Women Affairs Ministry here. If not, we'll start, and then when they join us, we'll be ready for them. So, with the ladies that we have right now, let's just get into it. Um, from your vantage point, what would you say is the single most pressing challenge facing Nigerian women today in terms of safety, empowerment, or well-being, and why? Prof, you can start. I think you're muted.
Oh, it is muted. Oh, thank you very much. Okay, let me start. I was hoping to start when others do, but let me start. I think that is a very challenging question to answer, right? Because I think that they are all interrelated, whether you're talking about safety, whether you're talking about empowerment, whether you are talking about well being. You can't have well being without safety, right? And you can't be said to be empowered without safety, right? So I think that they're all connected. And if you will permit me, I'm just going to kind of get out of answering it in that particular way. I would say that they are related, but that, of course, as human beings, our physical safety, our physical security often is primary, is uppermost in our minds. Um, if you don't have safety, of course, it becomes impossible for you to work and be financially, economically empowered. And that, of course, will affect your well being. If you're not physically safe, the chances that you will find yourself perhaps in a hospital, perhaps in a place psychological. Can you hear me? Can you hear
Yes,
me?
yes, I can now.
Okay. I just got a call from the back end, so I'm wondering if I was talking. Anyway, so bottom line, I feel that if you were to ask me, I think that safety, physical safety is really primary. But that said, it affects every other thing. And so, trying to place one above the other is really hard to do. Unfortunately, from all that we have witnessed and experienced, uh, well, some might say, I mean, we've experienced this over the years, but since January, when you hear about, women being killed with various implements, with hammers, with since the beginning of this year, being caught up in different pieces, we realize that, you know, um, yeah, we have to begin to talk about these issues. I think I'll stop here and let others speak.
Okay, thank you. Um, Dr. Ulasi, um, what do you think is the single most pressing challenge facing Nigerian women today in terms of safety, empowerment, or well-being, and why do you think so?
Thank you very much, Chidinma. It's very good to be here to contribute to this very important and sensitive discourse. I want to start by saying, first and foremost, I am bringing you greetings from my Director General, Binta Adamu Bello, OON. And fundamentally, I want to start by saying, on a very sad note, that unfortunately, the fundamental problem is the sociological constructions and stereotypes attributed to the female gender that is still so entrenched and deeply rooted, especially in developing countries of Africa, especially Nigeria, despite decades of effort to change the narrative and have a paradigm shift. All these sociological constructions and stereotypes, that demean the female gender is still deeply entrenched. So if you ask me, that is the major problem we have because the problem is fundamental and it has persisted over decades and is still there. So the theme of this webinar in commemoration of this 2025 International Women's Day, which is safety first, equality always, accelerating action for Nigerian women, to me, is a very compelling theme that is indeed apt, succinct, and germane. And it emphasizes the urgency of making faster, more effective strides towards gender safety, equality, and inclusivity. As a matter of fact, safety, equality of of female gender in the sphere of things, especially in Nigeria, the importance of changing the narrative and having a paradigm shift cannot be overemphasized. And I've already told you that fundamentally the major challenge is still those sociological constructions and stereotypes attributed to the female gender that is pulling down the female gender, exposing them to all manner of intimidation, all manner of discrimination, lack of inclusivity, both in the corporate world, in politics, and even at the grassroots. So these are the major things. Let me stop here for now. Yes.
Okay, I'm going to come back to you as the person from NAPTE
Mm.
to tell us more about the implementation of the VAP Act. But
Yeah.
if ACP Okuwobi can give me from your vantage point, what do you think is the single most pressing challenge facing women in Nigeria today? You're mute. Oh, we can't hear you.
Good afternoon once again. I
Yeah.
said I would like to say that the most pressing challenge facing women today in Nigeria has to do with our socio-cultural outlook of who a woman is in the is in the country. We would not definitely shy away from the fact that Nigeria is a patriarchal nation whereby women are treated as an unequal gender and that affects every other thing that affects women. As it relates to women being victims of criminalities, some men do not even see the fact that women are victims of criminality being perpetrated to them. They felt that women surely deserve those criminal acts towards them, like the issue of you know, giving out an underage in marriage, like the issue of gang raping a woman. Some men think that it's part of some even from young boys to men, they think that even if it is done, there's no big deal about it. So I want to believe that the problem we have is a societal problem on our hands, and there's need for a societal outlook, a general societal outlook towards addressing it. From the police angle, cases that have to do with GBV, gender-based violence, at times we even see that some women tend to accept the stereotyping in the society, and they tend to blame themselves for some things they're supposed to complain against. Even a situation whereby I remember as a DPO in Lagos those days, a situation whereby a woman or a girl is raped, she tends to believe that she should not talk about it. Maybe she has done something wrong for her to be a victim of rape. And at the same time, you even see the parents coming forward to say that they want to settle with the suspect, that's supposed to face the full wrath of the law for what he has done to the victim. And you see them saying that, oh, that they don't want any scandalization. And why are they talking about that? They're talking about that because of the societal expectation from them. They think the society will expect them to keep quiet, even in the face of GBV. So, just to sum it up, it's about the patriarchal structure that this country has. If not, if it's a situation whereby men do see women of being on the same opportunity level, definitely there will be less of cases of inequality. And the topic that we're talking about, let me just stop here so that other speakers to come.
Thank you. Thank you so much. I have a lot of questions to the police, but
Okay,
before,
go ahead.
no, no, not for now. Just I'm just putting you on notice. I also would like to welcome Mrs. Ekene Shobamu from the National Air Force Officers Wives Association. Um, yeah, she's representing the NAFOA president here today. Welcome, madam. And I'm also like to welcome Mariam Mukhtar from Gender Mobile Initiative. Um, Welcome, Mariam. Mrs. Ekene, Mrs. Ekene, if you can just jump into our conversation right now from your point of view, um, what do you think is the single most pressing challenge facing the Nigerian women today? I'm asking this so that is the foundation for our questions, so that we know what are the most important things, because I'm happy that we have the enforcers here and we have the policy people here. What's the most important thing? What's pressing our necks as women in Nigeria today?
All right. Good evening, the convener. I bring you greetings from the NAFOA President Architect, Mrs. Rekia Abubakar. I think the most pressing thing that is economic challenges. One, and our societal norm, our culture. That is one thing has that is being a rope being tied around our neck. Fear of stigmatization. What will people say? What will society say? If I should speak up, should I continue to bear this pain? Who will I run to? Societal norm. If we should um, try as much as we can to cross this boundary, to break this barrier, would have solved 50 or 90% of our problems. So yeah, that is what I feel one of the challenges we are facing. Economic challenges and our societal norms, our culture
Science,
as
culture.
regards men. Yeah.
It's interesting that everybody, most of us, are holding our culture responsible. Mariam Ali from Gender Mobile, are you ready to introduce yourself and speak on this
Yes, I
matter?
am. Thank you.
What's the singular pressing thing, um, challenge that the Nigerian woman faces today, and why do you say so?
Thank you so much. So, at your instance, please, I will want to turn off my camera because my internet is not that strong.
Okay,
But I will be speaking to everything that you have said. Thank you. Nice to meet everyone.
good to meet you
So, good
too.
evening, everybody. Thank you so much for having me as part of this evening's discussion. My name is Mariam Mokhtar Ali, and I am representing my executive lead, Barrister Omowumi Ogurotumi, who is the lead for Gender Mobile Initiative and is currently attending the CSW in New York. So she's unable to make this very important discussion. Having said that, I believe the single most pressing or concerning thing that affects women in Nigeria in the simplest term is gender inequality. And when I say this, I mean gender inequality in every angle. A woman is simply seen as, an object of ridicule or an object of manipulative conditioning. Everything seems to be working against women in Nigeria. And this is deeply engraved in our social norms, in our gender norms, and has become everyday life to the point whereby when a woman is seen to have made it, it is a thing of surprise. When a woman is being considered for anything, it feels like a thing of privilege. And this inequality runs across various, sectors from education, whereby a girl child is being taken as the opportunity cost in a family where the funds cannot cater to both a male and a female child, and she's being asked to step down for the male child because naturally she's being seen as not to be economically, of advantage beyond the boy. So right from childhood, that inequality seeps in. A woman is being, marginalized in the healthcare sector where emphasis are not being given to the fields that relate to women, especially when it comes to reproductive care. Women are being given less privileges when it comes to economic empowerment. When any initiative or program is being designed that speaks to women or says women are encouraged to apply, it feels like there is a special opportunity given to women. Whereas what I would consider to be normal is when that information is being put out, there would be no need to say women are encouraged to apply. Naturally, it should be balanced.
Mm.
Also, women are being marginalized extremely when it comes to political, affairs. And I don't want to say too much, but I feel in every sector, in every way, women are naturally marginalized beyond Nigeria. This is a global concern, and I believe this conversation is about time to be heard. And I want to mention that I'm here to add the little value that I can, but mostly learn from the wealth of wisdom that I see here. Thank you very much.
Thank you, Professor Chaluchi.
Yeah, hi.
Hi.
Very interesting already.
I need you to put some sunlight in this because it feels almost hopeless if it ends at the culture, right? So, in your experience, advising national policies, um, what data or evidence has been most persuasive in mobilizing policymakers to prioritize women's safety initiatives? Because the policy people are here. And I'm wondering, are there any legal reforms and public health frameworks? Is there a way it can be better integrated to address the two, like the two issues, the physical barriers and the psychological uh, repercussions from gender-based violence?
Okay, thank you very much. That's a very good question. Um, I mean, there's a lot of information and there's been a lot of data collection across different areas. As uh, many have noted, we have different types of gender based violence. You have physical violence, we have emotional violence, we have verbal violence, etc. But if you put it broadly, we have intimate partner violence, what we typically call domestic violence. We have sexual assaults. More recently, as you know, we've been talking about sexual harassment. Um, we have rape. We have intimidation. So some people have used the word intimidation. We have coercion. We even have obstetric violence, right? That is, violence in the course of delivering children. Some of us in the room may have experienced female genital mutilation. NATIP is in the room. Trafficking is one of the types of um, violence that women typically experience. And within trafficking, there are different types of concerns, but women in particular experience sexual abuse, sexual exploitation, being trafficked for the purpose of sexual exploitation, etc. In terms of the figures, if you look at the Nigeria Demographic Health Survey, it has some figures. It's a bit dated now, but I imagine that when we see the new edition, which is out sometime this year, we will see similar figures or maybe even higher. So, for example, we have the 31% of women ages 15 to 19, women, girls, in fact, 15 to 19 have experienced physical abuse. 30% of women from 15 to 49 have experienced physical violence as well. 36% of this abuse is from their partners. 32% of women have not sought help. 55% have not sought help in any way from any source. Only about 32% would have sought help. About 20% of women have experienced FGM. I work in the FGM space quite a bit, so I know that hopefully when these new figures come out, we will see a downward trend, but we still have that going on. And 20% is not a small number if we think that we're about 250 million people divided almost evenly into two, and so on. We have been, it is often said that we have some of the largest numbers of child brides in Africa, with about 23 million girls married off as
Yeah.
23 million girls and women married off as young girls. I think it was the ACP that rightly pointed that out. So child marriage is one of our challenges as well. So quite, I mean, if you just looking at the figures, it seems quite daunting. Seems almost I don't know, like something that cannot be addressed. But the truth is, I mean, there's been a lot of effort and a lot of intervention from a legal standpoint and from a policy standpoint. So everybody would probably know about the VAP Act. I think maybe it was the host that mentioned the VAP Act.
Yeah.
So we have the Violence Against Persons Prohibition Act. We have the Criminal Code. We have the Penal Code. While many of the offenses have been more or less subsumed into the Violence Against Persons Prohibition Act, there are still a few other offenses within those codes that are also still applicable. Beyond that, I mean, we have the Child Rights Act. So, for example, when we talk about child marriage, etc., that is definitely something to look at. I should have probably started with our most fundamental law, which is the Constitution of the Federal Republic of Nigeria, which contains the fundamental right to dignity, to freedom from cruel punishment, torture, and degradation, and many of these acts of violence. Many of these things that we talk about, even that we call physical abuse. Imagine somebody being doused in petrol. There's I don't know what could be more could define torture more. So you have all of these pieces of legislation. We have gone ahead to make, even beyond the legislation, several policies in the gender space. Um, we have the health sector response to GBV, which I helped to draw up a few years ago. We have the national policy on sexual and reproductive health and rights of persons with disabilities, which also includes emphasis on discrimination and violence against women and girls with disabilities. We have the National Policy and Action Plan on Elimination of Female Genital Mutilation 2021, which I was privileged to work on a few years ago, and so on. So quite a number of policies, and I am limiting it in order not to take up the time that other people are going to use to speak. In all of these, it seems fairly clear that as a country, we recognize at different levels the need for us to prevent violence against women and girls, the need to punish it, etc. However, what we're seeing on the ground does not bear out the fact that we're fully, effectively implementing these laws. I'm not sure why it's echoing, but we've made certain interventions. I'm sure people in the room will speak about the sexual and gender-based violence response teams that you have in different states. Lagos State actually has a law that establishes its domestic violence and sexual assault agency. It's actually an agency in Lagos State. I know the FCT has theirs, etc. We have different states having sexual assault referral centers. So there are a number of interventions that have been put in place. Many of these interventions work hand in hand with NAPTIP, and I'm sure they will tell us what they do. But the point I want to, and then of course I should mention very quickly that the VAP Act is one of those laws, because criminal law in general is what we call a residual matter. That is, states have almost full authority over it within their own territories. And you have the Fed. So you have the VAP Act, which applies in the FCT. And then it has been more or less adopted across the country. Ekiti State has something different, which they've always had before, the VAP Act, and Lagos State has something different. But in essence, this is an issue that, at least at the policy level, seems to have a certain level of agreement. Now, if we go and piece it down and start talking about other different issues like sexual harassment, we get into another space. But some of the big issues, the intimate partner violence, physical violence, all of those things are well covered under the VAP Act. Let me stop there so that I let others speak. Thank you.
Okay. I've also been made aware that the director in charge of in charge of the department for implementation of the VAP Act is here. I'm going to give him a chance to speak on that, on the VAP Act briefly. Before I would also like to hear from ACP Okuobi after he speaks on enforcement and the challenges therein. Before I go to Dr. Olase, and I will also want to hear from the NAFOA perspective about the women. But Dr. Udwak, if you're ready, you can tell us about the VAP Act and implementation of the VAP Act so far. Okay, I think we're not able to get to him. If it's ACP Okuobi, are you able to talk to us about implementation of, or rather enforcement of all of these laws that Prof has spoken about? What are the challenges that the police faces in implementing enforcing these laws? Is ACP here? Okay.
Hello.
Yes, I can hear you.
Good evening once again,
Yes,
everybody. I think the network is funny somehow from here, but I just hope that I'm being heard.
I can hear you, madam.
Well, some of the challenge, okay, some of the challenges in the Nigerian police force, some used to be part of challenges from the Nigerian police, but we've been able to surmount it by coming up with gender policy, the Nigerian Police Force gender policy, which is designed to provide technical capacity for Nigerian police officers on how to handle gender-based violence. And but part of that has been surmounted by the Nigerian Police Force. But part of the challenges we really have has to do with the members of the public, the victims themselves. At times, many victims find it difficult to come up and actually report to the police. And even eventually, when they come up to report, an investigation has started, you see them begging that the cases involving them should be compounded, that they've forgiven the person and they want to settle with the person or maybe the parent of the victims. When I talk about maybe gender-based violence, you see the parents coming up to say, okay, the man has offered to pay us so amount of money. And I remember that the question we normally ask is, if it is a case of um, sexual offense against a female or even a male child, the question we ask is, if the money is collected, can you in any way, can that money in any way buy back the honor of the person that has been violated? Can it in any way psychologically erase the psychological effects that the offense perpetrated on this person? Can it effectively erase it? So the major challenge we have is lack of cooperation from members of the public. We do not have challenges as it relates to our laws. Our laws are supposed to be enforced by us, which we are doing. And the Nigerian Police Force has made it a point of duty that cases of gender-based violence, especially when it has to do with sexual offenses, it's not something that the division can handle and end or maybe try to cut. It's something that you have to escalate to the higher level of police investigative department, mostly state CID, to handle. So that is just to let you know that the Nigerian Police Force takes cases of GBV very seriously, to the extent that such cases should be handled by higher authority. Then we also presently we have gender-based gender deaths in all our divisions nationwide, whereby when you have cases that has to do with violation of your rights or with questioning of your safety, because safety first is a fundamental mental issue. It's a fundamental human right. Your personal safety comes first. As a person, you are entitled to your safety, and it is actually a statement that's a call to action that everybody needs to be told that their safety first matters most than any other person around them. Safety in terms of being comfortable with their body, and also from our own end, we embark on community engagement from where we use the opportunity to educate women and even boy child on the need to believe in respect for their body and in giving consent. I'm talking about adults now because children can definitely grant as I am consent to being abused either sexually or physically. So, so from the police, our major challenge has to do with the victims, the communities, the way some of them will even come around and start stigmatizing victims um, of inequalities, victims of GBV. So it is the problem, the major challenge is from the community, not even from the judiciary now, not even from the, and not even from within presently. Presently, the Inspector General of Police, IGP Egbetokun, came up with this. This is our Nigerian Police Force gender policy. As you can see, this is this one was produced just last year, and with the assistance of all these international bodies, these documents came into existence. And it is just for you to know that the Nigerian Police Force takes it seriously, to the extent that we have a first gender officer in the person of AIG Aishat Bajo. She's the most senior policewoman in Nigeria. And so from within us, we have tackled the challenges we have as it relates to handling gender-based violence. I just want to use this medium to call on Nigerians to seize the opportunity presented before them, to seize the reform that the Nigerian Police Force has carried out from within itself as it relates to GBV cases. So they should feel free to talk to us, to go to our gender-based desk, and seek for redress wherever they think they deserve to be helped. So the Nigerian Police Force has really done so much, but the challenges has to do with them. Under reporting is another challenge. They do not report. It is at times when we see on social media, that's when the first PRO will take it up upon himself to direct the commissioner of police in the state concerned to fish out the perpetrator of criminal acts against the victim that is seen on social media, and to seek to grant justice to the victim of GBV or abuse. So the Nigerian Police Force, we do not only wait, we no longer wait for you to even bring cases to the police station. Even when they are cited on social media, when a child is being abused, when a woman is being abused, anytime we see such a thing on social media, we pick it up and we ensure that justice is served.
Okay, so ACP, you're saying that any woman who is uh, who is a victim of gender-based violence can walk into any police station in Nigeria and she will be listened to and treated with dignity.
Sure, with dignity, yes.
Okay.
Now it's a thing of the past whereby a woman will go to the police station and she will be told that go back to your husband's house. Her husband is scarce, this and that, or they'll be disparaging her. You understand? She'll be treated with, because we have a gender desk apart from JWC, Juvenile and Women Center. For instance, like in Lagos State, the office of the gender the gender office in Lagos used to have a CSP as the head, but just because of the importance attached to that office is an assistant commissioner of police who handles the matter now. And do you know that that office has um a they have a kind of they have some whistleblowers that alert them on gender-based violence violations, and immediately such information gets to them, they take up the challenge and look for the victim so that the victim can get justice.
Okay. Thank you. We have a lot of comments online, but I would like Dr. Lassie to speak a little bit on the VAP Act and the implementation, because we know that the VAP Act is domiciled with NAPTEP for implementation. Dr. Lassie, can you tell us a little bit about the implementation of the VAP Act, um, the challenges and the limitations, and um, yeah, how far has NAPTIP gone in implementation of the VAP Act?
Yes, thank you very much, Chidinma. So far, so good. And I want to start by saying that statistically, Nigeria ranks 123rd out of 156 countries in Global Gender Index 2023. And one in every three Nigerian women in Nigeria experience gender-based violence. NAPTIP, the National Agency for the Prohibition of Trafficking in Persons, has the mandate of fighting trafficking in persons. And in 2015, NAPTIP was mandated also to administer the Violence Against Persons Prohibition Act. And so far, so good. We are carrying both responsibilities very well. And I want to also state here categorically that, fighting human trafficking, fighting violence against persons, they are related and intertwined. So most of the time, the method and the processes we use in fighting human trafficking, especially in dealing with victims of the crime, is equally the same method we use in the implementation of the violence where it concerns the victims of violence against persons. And may I also use this opportunity to tell you that the crime of human trafficking and also violence against persons is so feminized. It's so feminized in the sense that more than 75% of victims of human trafficking
And
are
women.
females. That is why I said that the crime is so feminized. So to speak, is a gender-based crime mainly, both TIP, trafficking in persons, and violence against persons. And in ensuring safety and equality always for women, NATI plays a critical role in protecting women and girls from exploitation, ensuring their safety, promoting equality through legal action, advocacy, empowerment program, and a lot of other methods we use. And if I have to list some of the crime under the VAP Act, we have rape, we have incest, we have spousal battery, we have harmful widowhood practices, we have female genital mutilation, intimidation, stalking, political violence. And may I also specifically say here is that both the police and other law enforcement agencies will collaborate in fighting these twin crimes, that is trafficking in persons and violence against persons. I was listening very attentively when my colleague from the police force is speaking, because most of the time, the first responder people usually go to, even before at times before they come to NAP, is the first instinct is to rush the police to make a report. And most of the time, when the case is established that is a human trafficking case or violence against persons case, usually the police usually refer the case to NAP, because in NAP we have trained personnel, on how to, tackle TIP and violence against persons. So it's a collaborative effort kind of in the implementation of the vaccine. So when we come to specifics, what we do here, NAPTIP provides a comprehensive range of protection services to victims of TIP and victims of VAP. Most of them are women, spanning from reception. We receive them reception, sheltering, counseling, providing psychosocial support, medical, legal services, then to rehabilitation, empowerment, and reintegration back to the society. Talking about counseling and psychosocial support, most of the time, some of the victims of gender-based violence, they come so traumatized. Of course, you can imagine what it feels like when somebody comes in as a victim of rape. And most of the time, we get victims as young as 5-year-old, 6-year-old babies being raped by men. We have spousal battery, all manner of spousal batteries, for gender-based violence. So we have standardized procedures we utilize in handling these victims of both VAP and TIP. And it starts with
Oh dear, just when it got interesting. Oh, okay. She went off. I want to quickly go to Mrs. Shogamu to talk to us about Nafawa, the
yes,
women. Okay, Dr.
hello,
Lassie. Okay.
yes, but please, it's the network. So, like I was saying before the network went bad, it starts from reception, sheltering, counseling, providing psychosocial support for both victims of VAP and victims of TIP. We provide Medicare services. We have legal services, both pro bono services, we used to provide. And then we have rehabilitation, empowerment, and reintegration back to the society. And from inception of NAPTIP till now, the statistics of victims we have rescued, both victims of TIP and violence against persons, we've been able to rescue 24,345 victims. And out of these victims, 18,160, representing 75%, are women and girls. Because when we talk about this gender violence, I always like to express that it's not only
Women.
women and the female gender that it affects. The
Yeah.
male gender can also be affected
True.
by gender. It's true that the percentage, the highest number of percentage, of course, is the female gender. And these statistics underscores the urgent need to keep women's protection at the center of our national response mechanism. We have this beautiful policy document we call National Policy on Protection and Assistance to Trafficked Persons in Nigeria. Originally, a major mandate is trafficking in persons before the Violence Against Persons Act, was domiciled with active. And we have standardized processes we use. And this document is endorsed by the Federal Executive Council of Nigeria, endorsed by ECOWAS. So inside the document, we have processes we use, in rehabilitating and trying to give psychosocial support to all these victims of human trafficking and violence against persons. Because they come with so much trauma that you don't just, handle them and push them back to the society. There's a systemic process you have to use before you bring them out of trauma, the psychosocial support, and for victims of trafficking in persons also. Most of them, are victims because ab initio they don't have any source of livelihood and things like that. So if you just bring them, just push them back to the society like that, you end up, haven't done anything because they'll be liable to being re-trafficked. And that is why we have empowerment in our rehabilitation process where we give them educational and vocational empowerment that will prepare them for integration back to society to function
Okay.
as citizens of the society. Yes.
Okay.
So the methods and the processes are not so different because all of them are victims, all of them are traumatized, all of them needs to go through these processes before you restore them back to sanity to operate efficiently.
Okay. I'm going to come back to all the people who have spoken. And I'm personally taking, I'm a little bit overwhelmed. There's so much on paper, right? So when we come back, we're going to talk reality. But before, and then, yeah, we will listen to some comments that have come from viewers online before we talk reality, but not now, comfort. I want to hear from Nafoa. Um, I want to hear from Nafoa because I know that dealing with wives of officers, women who are wives of officers, kind of like they interact and engage society a little bit different from the rest of us who are not wives of officers. So I would like to hear from the Nafoa perspective. How do you how do you deal with issues of gender-based violence in the Air Force?
Yes. Thank you very much. Good evening again to everyone. NAFOA itself is a non-governmental organization. As military wives, military officers' wives, we are more concerned about the wives of our soldiers and those that are based in our military barracks and in our bases. Most often, we take the fights to them there because the wives are not so, should I say, are not so open towards society or what happens in the outside world. They live in the barracks, they live in the bases there. They do not know what happens outside the walls of the barracks. So we officers' wives that are enlightened usually take this fight or this sensitization to them. We got there with our public address systems, even on the 8th, when we celebrated the International Women's Day, we were there at the Mogadishu barracks, telling and trying to tell these women not to stay silent. Things are not how they used to be now. You have to come out, you have to speak out. You have people with open arms who are ready to help you out. The NAFOA president has our doors wide open to welcome stakeholders and collaborate with anybody who is ready to work with NAFOA. Because we know that most of the issues are usually based on finances, economic, or on very little money that comes into the family. So every year, she has skills acquisitions. She has graduates from these skills acquisitions that they learn different kinds of skills that can equip them to help their family out. In the family settings, sometimes in the barracks, you see family members, uncles who come to visit, and they end up violating the girl child there. The mothers do not speak out. They keep quiet because of stigmatization, and what will people say when they know that my child who is less than 12 years has been violated? These are the issues that we normally face. And NAFOA is at the forefront of helping these women understand that even people who have faced these issues are coming out now. There's nothing to be shy of anymore. You come out, we help you to fight the trauma. We help you to understand that you are important and you do not need to stay silent. We are open for collaboration to any stakeholder. We are doing a lot, but how much can an individual NGO do? It's so much. When you hear stories, it's heart-wrenching. But then we thank God for our mommy, the NAFOA president, who is always ready to help us out. Our main focus is usually the wives and the widows and the people living in the barracks. And those ones we are able to take care as much as we can do. Thank you very much.
Okay, so what I'm hearing is that if a woman or a girl steps forward, she's going to get justice. That's what I'm
Yes,
hearing. Okay,
yes.
we'll hold the thought. Miriam, let's talk to us about gender-based violence and finances, because Mrs. Ekene says that what they see is that the violence comes when the money is tight. What have you seen in your work?
Thank you so much for this opportunity. So, Gender Mobile technically works to complement the efforts of government in trying to combat gender based violence across various sectors. And one of those sectors is our houses, our households. And it's very typical to, cite an example that one of the major types of gender based violence is financial violence. And this is a form of violence that we see happen where, the man, typically the head of the family, either restricts the wife from earning or finds a way to curb her earning into his own, or, shies away from his responsibilities as the head of the family and lets the woman handles all that, thereby making her, financially, or um for lack of a better word, out of finances. So this is a very typical, form of gender-based violence that we come across in our work. However, I would like to say that most of what we do is on our initiative that is called the Campus Safety Initiative, where we have also seen examples of financial violence. And this Campus Safety Initiative is, has to do with tertiary institutions where we try to educate both the student and the staff on not just gender-based violence now, but sexual harassment. And what that does is, we have four pillars that we work with. We have the policy, so we work with these institutions. Currently, we're working with over 120 institutions across the country. We work with them to institute policies that speak against gender-based violence and sexual harassment. We also work with them in the bystander intervention, which is educating the students to be active bystanders and not passive ones, whereby they can be whistleblowers, they can save the lives of other people. And we have the Campus Pal app, which is infusing technology into reportage. And what this does is give the students and staff the mechanism to report cases of sexual based violence and sexual harassment. Another pillar is the educational pillar, the sensitization pillar, where we have infused educational materials into this Campus Pal app. And the reason why we are deploying this initiative is because students have been reported. We all know that there is high incidence of sexual harassment in the campuses, but this does not only stop at physical harassment. It includes financial harassment as well, whereby some students are being demanded to, either give money or pay with their bodies and all of that. So we see a lot of these examples, and we try to combat it with through policy reforms, policy adoption, and policy adaptation. We work closely with the ICPC to report critical cases of both domestic gender-based violence, sexual-based violence, and also sexual harassment. And so far, there are so many studies that we are currently working on, publications that we're currently working on, to not just create the much needed awareness, but also give people the statistics of where we are now in terms of gender based violence and sexual harassment. Thank you.
Thank you very much. So what we will do now is we have comments and feedback from what we have done so far from our viewers online. So we will listen to those comments and feedback, and then when we get back, we have heard everything that is on paper. It's now important for us to talk some reality, to speak some real things, because we have all agreed that gender-based violence of any kind is real. We have agreed that it is keeping women back. As women, all of us here in positions of authority, we need to speak in real terms. Really, what can a woman, let's leave government now, what will women do? But first, let's listen to the comments that we have got online, and then we'll come back.
All right, good evening, everyone. My name is Comfort. I'm a staff of Athena Centre. Um, the conversation so far has been great, enlightening, engaging, and our viewers have been following up with us. So I'm just going to read some of the comments that they have dropped. All right, so we have one from Helen Maleshe. Helen says it is important to have a collaborative, multi-sectorial approach, including the grassroots levels, to address these historical gender issues and somewhat institutionalized attitudes and perceptions towards women and girls. Since many policies are in place and several organizations have initiatives rolled out, the focus should be to work together. All right, so we have another one from Joy Olajide. Joy says, this brings me to my concerns. This is a beautiful and a sensitive conversation. Is there a way NGOs can be supported more to help penetrate this into various grassroots? Iruka Aru says, let's encourage our male officers to also publicly challenge harmful practices and attitudes in their communities. We have one from Ifisi. Many victims withdraw cases because of religious or cultural pressure. Since religious and traditional leaders have a strong influence in Nigeria, they should be engaged to support this mission. Zubaida Buka Umar says issues around gender-based violence is high around our military communities, and we will be glad to collaborate with actors to create awareness, build capacity, and design mechanisms to respond to incidences of violence through NAFOA. So these are just some of the comments that we've been able to highlight, but there are a lot more. I think people are finding this very engaging.
We also, Athena also conducted a survey last week um, around the country relating to women's safety. I don't know if Sarah is ready to show the results of that results. Are you ready, Sarah?
Yes.
Okay.
Good evening, everyone. It's a privilege to share these findings from our survey that we conducted last week regarding the safety of women. The survey aimed to capture the experiences, perceptions, and concerns of women regarding their safety and to provide platform to share their voices, concerns, and suggestions to creating a safer environment for women. Our survey collected responses from 204 respondents. Well, we have a disclaimer because it's an online survey. So the survey was conducted online and distributed through various digital platforms, allowing voluntary participation from respondents across Nigeria. As a self-reported online-based survey, they were influenced by selection bias, digital access disparities, and the subjective nature of personal experience. While the insights provide valuable perspective on women's safety, they may not fully represent the experiences of all Nigerian women, particularly those without online access. The findings should be considered indicative rather than comprehensive, and further research, both qualitative and quantitative, is means respondents were self-selected rather than randomly chosen. So it primarily includes individuals who are active online and willing to participate. Another potential bias in the survey is digital divide. Women without internet access, low digital literacy, or those in rural areas may be underrepresented, potentially skewing results towards urban, educated, and digitally connected demographics. The another potential bias is self-reported data. Responses are subjective and rely on personal experiences and perception. Some respondents may overreport or underreport incidents due to memory recall issues, social desirability bias, or trauma. And then demographic skewing, higher response rates from specific states, FCT, Kaduna, Kano, Lagos, suggest a geographical imbalance, potentially underrepresenting the realities of women in other parts of Nigeria. Our survey was 100% anonymous. So moving on, let's look at the key data points from our survey on women's safety in Nigeria. General perception of women's safety. 75% of respondents feel safe in their community, but 25% do not. On a scale of 1 to 10, the respondents were asked to tell us how safe they feel within their community, and the most common responses were 7. And that's on a scale of 10, 1 to 10, 7 people. 30, we have 30 responses who feel like on a rate of 7/10, they feel safe. And then on 20, we got 27 responses, which means 27 people do not feel safe in their community. And we got 24 responses saying that they are rating their safety 9/10. What are the experiences with gender-based violence and harassment? So 49% of our respondents have experienced gender-based violence or harassment, while 51% do not or have not experienced gender-based violence. And this type of harassment experienced are verbal violence, social violence, gender discrimination, physical violence, socio-economic violence, and attempted murder. Who are the perpetrators of this violence? Okay, so we have, from our response, we got that 18% of the perpetrators were strangers, 11% were male teachers or tutors, 10% were male extended family members, 10% was male friends, and 8% husbands. 42% of respondents cited other perpetrators, but among identified Pepe tutors are strangers, male tutors, male extended family members, male friends, and husbands. Safety precautions taken by women. So 65% of our responded have how to change their daily routine, which includes workplaces, their route to work, and other things that they do due to safety concerns, while 35% have not changed their daily routine. And when we ask them in which states do they have to change their routines due to safety concerns, we have the top 5 states, which are Kaduna, topping the charts, Federal Capital Territory, Lagos, Kano, and Anambra states. Reporting of incidents. Our respondents told us that 52% of our respondents have avoided reporting incidents due to fear of backlash, stigma, or distrust in authority. So types of incidents that were not reported to fear of backlash, stigma, and distrust in authorities are sexual violence 30%, verbal violence 23%, gender discrimination 18%, physical violence 16%, and social law enforcement and women rights awareness. 66% of our respondents are not agency effectively protects women. 77% of our respondents have never benefited, and 72% are unaware of emergency helplines, shelters, or legal aid services for women facing violence. Who should ensure women's safety in Nigeria? When we asked, our responded first of all, um, said the government, which is topping the chart here. 32% of our respondents say the government are the ones who should play a key role in ensuring safety, followed by religious organizations, men, human rights group, and cultural organizations. 98% believe women have a role to play in ensuring their own safety also. So they did not just leave it for the government, cultural organization, religious organization, men, and human rights group. Recommended safety measures. Our respondent recommend that legal protections and enforcement should be made. We also have 26% recommending women's empowerment, 25% recommending safety awareness campaigns, and 19% recommending self-defense training programs. And when we ask about the role of men in women's safety, so these are what we got. 30% suggests that men should promote or practice respectful behavior towards women. They should also lend their voice, in the fight against harassment. 23% said that men should percent suggests that men should support and believe women. Awareness and career advancement.
Okay. Um, Thank you. Thank you, Sarah. So I had said that when we come back, we're going to be talking some reality. The Gen Zs will say that some tables have been shattered here. But I think this is a very interesting survey. And I feel like every panelist here has something to say on this. I want to start from Professor Cheluchi. We're just going to take about 15 minutes for this section. It's just because what it says here, this is a small sample, yes, but we have had an opportunity to hear from people how they really feel. And I feel like some of the results that we got out of it are very, very telling. Professor Cheluchi, talk to us. Is Professor Cheluchi still here?
I am.
Okay. So you saw that too many things to take from, to touch on for us to talk about, but I think I'm curious about, okay, tell me, from the numbers you have seen, um I think that I was going to ask you about the the law, the law that talks about how to prove rape and how to prosecute rape cases. And me and you know how difficult that is. But let's talk to us a little bit about that.
Okay, thank you. And thank you to Athena for that interesting survey. I mean, I know it's online focused, but what was interesting to me about it is how much it aligns with all the other data that I have provided to you, and some of those states that were identified as having some of the highest numbers in different data also show highest numbers. So I think that first of all, one of the things to think about is, how we can really using that the data, ensure that we are implementing evidence-based interventions. That said, in terms of rape, I think that the BAP Act has been a step in the right direction. There are a few things that it says. I won't go and repeat every single thing, but we know that now rape can be, one can be charged with rape when there has been any kind of penetration, and it doesn't have to be, with a physical part, with a body part. It can be any other thing, which is, I mean, for those of us who work in the field, that's something that we see. Other than that, I think it continues to be a difficult crime to prove because you need to present certain kinds of evidence in order to show that you have experienced that sort of traumatic invasion. Typically, we would require some kind of forensic evidence. Now that you can be raped with anything, perhaps what do you call it? The specimen from bodily specimen. Let me not start calling out different things. Bodily fluids and all of that may not necessarily 100% be required. But there needs to be some form of evidence. In the past, the courts would require some kind of corroboration and so on. But now, of course, more and more we're looking towards forensics, and that is where some of our sexual assault referral centers come in. Because when they come in, they have this pathway, this referral pathway to make the required reports to the police, to the DPP's office, and so on. So all of that is connected within the sexual assault referral centers. The challenge, however, is that I don't think that we have as much information, awareness, and sensitization about what the SACs do, where they are located. In Lagos, for example, we have at least two that I know about. We have the Mirabel Center, we have Warif, etc. But again, Lagos is actually, it tends to be really sensitive to these matters. We have the DVSA, which can refer you to everywhere. But there are states where, some of these interventions are not yet available. So when people have those circumstances, typically, I mean, we say it over and over, don't have a shower and all that, get to the hospital immediately, etc. There are cases where in the past it used to be said that the courts would not take evidence from the public from hospitals that are in the private sector, and that the preference is for hospitals in the public sector. I think that continues to be the preference, but I do know that there are some cases that are now saying that, they would take that of any reputable doctor, etc. Bottom line, what am I saying? I think that it continues to be to prove those kinds of cases, and that evidence, the evidence threshold remains high. There was a case in Lagos towards the end of last year, which was overturned on appeal. Again, the Court of Appeal's decision was again based on, the evidence. So I think, first of all, if you want to make a case for rape, the more evidence you have, the better. We're in a better place with the VAP Act, but that still he who asserts still has to prove under our Evidence Act. Every information, evidence such as that given by an expert, because you presented yourself at the hospital and you received all of that support, or you presented yourself at a sexual assault referral center, would still be really helpful, because the law would always, be reticent and reluctant to find somebody guilty without adequate evidence. So it continues to be quite challenging. And I think that the way to solve that, of course, is to make information more and more available. And that is why I love what we're doing here. And I hope that those in the audience, are paying attention and can step down some of what is being said here. We need more information to be out there. You have this sort of situation, you have to get to a facility, public facilities, more preferred than private facilities, but please go to a private facility if a public facility is not close by. The DPP's office can still work with that evidence, etc. And and then go ahead and make a report. We've heard about the gender desks, which the ACP talked about. We now have those in place. More and more, they're being trained every day. I know because I'm part of some of those trainings. They're being trained every day. They're receptive. The females working in the police force, especially at the highest levels, are giving support to this process. And so we need to give them what they need to go ahead and make those cases. Bottom line, yeah, a mountain to climb, but it's getting lower and lower every day to climb that mountain. And I think that we can, using what we have in place in the places that we have them, push towards justice for rape survivors.
Yeah.
That said, I'll end with one more thing. There are still states that don't have these SACs, and therefore that's advocacy that will need to continue to happen. Over.
Exactly. ACP Okuobi, are you still here? Okay, while we wait for her, Dr. Olassi. Dr. Olassi.
Yes, Professor Chaliti has already, said a lot, what I wanted to say. But what I want to chip in here about rape, is still the VAP Act that, persecutes, have provision for the prosecution of perpetrators, people that commit rape. But what I want to chip in here is that most of the time, victims of rape, they don't report on time. They don't report on time. And we are utilizing a lot of prevention and awareness creation, for people to be able to, victims to be able to speak up in time. Because most of the time, before they come to report about this rape case, most of the time, if you take them even to the SAC, the reference center, sexual assault reference center, you will not even find any concrete evidence, a specimen to collect from their body that is going to help to prove the case of this rape. So what we do in this, from this angle, is to utilize a lot of awareness creation. Prevention is one of our cardinal principles we use, in addition to protection, which I have talked so much about. creating awareness that when something happens, you report on time. You come on time so that specimen can be taken that will be useful in proving cases or a case of rape or cases of rape. Because most of the time you find out that by the time these victims will be presenting, or coming to NAPTIP to report, maybe the rape had happened more than 2 weeks, 3 weeks, and they will be telling stories. By that time, you will not get any specimen. And that is why the forensics, we are looking at forensic, a lot to help us to prove it because of the fact that victims do not present on time. And this is where SAC is very, very important. So we create awareness a lot for them to report on time. And again, before we finish the discussion, I will have to drop NAPTIP short code, which is just 627. For anybody, for everybody listening to me now, if there is any of this incident, just call 627, report the case, and our officers, there's 24 hours line. So at any point in time you call, you will have somebody that is going to direct you exactly on what to do. We have the rapid response squad that are there, on ground to help you to, do the right things at the right time so that we get enough evidence. Most of them, our prosecutors will be scratching for evidence because the victims do not present on time. So the short code is 627. And we have a hotline. And the number is 070-30,203. And we have info@naptip.gov.ng. These are, information line you can easily use to get those reports at the appropriate quarters. So prevention, we utilize it a lot. The prosecution, we have a lot of perpetrators we've already convicted that are serving various jail terms behind bars. But the key to it is that victims should report on time. If you see something, you say something. Even if you're not the victim, when you see something happening around your vicinity, always say something, honestly. And people are always very conscious about this stigmatization stuff. Most of the time, it impedes the rate at which people report cases. So we're encouraging people through prevention, awareness raising to speak up because there is no other way we can help you. There's no other way we can get justice for you except when you report on time. Yes, and again, the VAP Act is an FCT stuff. Apart from this state, other states that are adopting it, we also have protection officers in the 6 area councils of Abuja, NAPTIP protection officers emanating from the VAP Act. Their duties is there, if there is any case in the area council, they will help to facilitate the victims to be able to do the right thing and bring the case to the headquarters where we treat it on point. Our prosecution department, they are trained to handle both TIP cases and VAP cases. So feel free to report to NAPTIP. And most of the time, police, when they discover or establish that a case is VAP case or human trafficking case, they direct it immediately to NAPTIP because we are specially trained to handle all these issues, utilizing our 5 P's approach of policy, protection, prosecution, prevention, and partnership. And in partnership is very critical because we liaise with relevant stakeholders, law enforcement agencies, CSOs. And by so doing, we have task force in state task forces, because we want to be everywhere. We want to be able to collect information and be able to tackle these mandates we have, the TIP mandate and the violence against persons mandate. So I want to repeat the short code. The short code is 627. And the hotline is 070-30,203. And the email is info@naptip.gov.ng for prompt action because we have people 24/7. We even run shifts to be able to deal with this. Our rapid response are there on ground 24 hours to deal with these issues, especially with that issue of rape. Getting the specimen and getting something we can use to be able to get justice for the victims. Thank you.
Thank you so much. That is so important, and I do agree that one of the biggest problems is awareness, and just from our conversation alone, I feel like so much has been brought out for Nigerian women to know. I would like to direct my next question, and then I would ask for closing remarks from each of the panelists. Mrs. Showa from Nafowa, you saw the alarming amount of women who say they have never benefited from any women-led initiatives, right? So there's something else that I'm seeing here. In as much as there's so much going on, how do you? I know that you are particularly focused on like the military wives, the Air Force officers' wives, but I just wonder how how do you think that how do you think that aid and all of this support can get to a wider spread of women across the country?
Thank you very much. The media has to come in. The media must come in as a matter of urgency. If it's on radio, if it's on TV, if it's on Facebook, if it's on Instagram, if it's everywhere, there will be awareness. We cannot afford to keep silence. The cases are alarming. It is a matter of urgency as it stands. Right now in Nigeria, there's actually no family that don't have a Gen Z with a phone, a mobile phone. Tell someone, speak up. All hands must be on deck. In the barracks, when such cases are reported, first thing, the soldier that is involved must be moved out of the base, out of the barracks. We have clinics in our bases, in our barracks. We encourage women to take your children who have been violated there. Rape kits are provided in these clinics. You take specimen, but again, how many people come out because of this stigmatization? We thank God that it's not as bad as it used to be, though it can be better, but things are being put in place. Awareness is being created. It is no longer a thing of, oh, I've been shamed. Yes, I have been shamed, but I do not want the next person to go through what I just went through.
Absolutely.
Yeah. So all hands should be on deck. The media should be involved. The lawmakers, this verb should be repealed, reenacted, so that people will be aware.
Okay.
Yeah. So when we all come together to fight, I think we will do so much. We'll do
Yeah.
so much. And we
Yes.
are a lot. Thank you
Thank
very
you.
much.
Thank
Yes,
you
ma'am.
very much. ACP Okuobi, I had a pressing question for you. What do we do
Yes.
about absence of trust? Because if you saw the results from the survey, an alarming number of women do not feel like they can trust the law enforcement officials or agencies. Now, you told us all of this, everything is set there, it's available, but what do you do to make the Nigerian woman trust the police that if I go there, I'm going to get what I need?
Well, thank you very much, madam. Well, what I will say is the fact that Rome is not built in a day. I just told you that we just concluded our gender policy on what we're talking about. And the Nigeria Police Force takes it to heart to even come up with a gender policy document as close as last year, 2024. So in view of that, a lot is being done, a lot of trainings are being carried out for both policemen and policewomen, for the personnel at the charge room, which is the first port of call at police stations, where is popularly called, the place that is popularly called counter. So a lot of CROs, charge room officers have been trained on how to handle report of GBV, gender-based violence, on how to attend to them, on how to incident the matter, lot of trainings are going on and it's still going on. So I just want to appeal to Nigerians to know that we are committed to serving them. We are committed to protect them and serve them also with dignity. All these the trainings that we have are about this, on how to enforce the law, the relevant laws on GBV. Trainings have been going on about that. From within us, we are doing a lot of
Oh, okay. It looks like we lost her. I'm going to start to round up this very, very interesting conversation. One of the main things that has come out of here is the necessity for coordination and cooperation among all of these bodies, the policymakers, the law enforcement people, the lawmakers, and even the regular man on the street. Coordination and cooperation is very, 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 very important for us move to move the needle as far as the plight of the Nigerian woman forward. I was going to have everyone make last final comments, but maybe what I would like to ask is, everybody said one thing the same. This culture, socio-cultural issues, what should we do? Everybody, all the panelists, one sentence, what can we do? Because we all came and we just blamed somebody called culture for why we are not moving ahead as we should. So I would like to hear from all the panelists as quick and shortly as possible. What should we do? Um, Dr. Lassie.
The like I said before, the sociological construction and stereotype is so deeply entrenched. And what can we do? We have to keep on talking. We have to keep on creating awareness on the need, to have a paradigm shift. Yes, that's just what we have to do basically, because that is still the root cause and the fundamental cause of what women are going through in this society.
I
Yes.
agree. Thank you very much. Professor Cheluchi.
Thank you very much. I concur with Dr. Ulasi on what she said, but I will go as far as also saying that we need to, not all of us are going to be in positions where we come at to these sorts of things and have these sorts of pallies. But all of us can do something with persons that we know in our own space. We can show up for people. We can say we will not look away when you are going through something terrible.
Mm,
We can show up by being all of ourselves,
mhm.
being ambitious, going out there and achieving things. We can help by getting the men in our lives, the people that we have influence, the men that we have influence over, to speak to other men and say, it is okay to have a wife that is working, that is doing great things, and so on. You still remain important in their lives. So there's so many little things that we have to do. It is important that as we're engaging men, that we're supporting CSOs and NGOs that are working in this space. You don't have to be, a Bill and Melinda Gates Foundation or any other big organization to donate something, to make an input, to ask, how can I help a sexual assault referral center near me? So there's so many different things that we could be doing, and we should go out and do all of them. All of these things, we've said them before. Let us see. If the only space you have is your social media space, please go there and show up powerfully in that space and encourage people to see women as human and women as equal. Thank you.
Awesome. ACP Okuobi.
Yes. Well, as we conclude this discussion, I want to say that we from the Nigeria Police Force, we recognize that women's safety and equality are fundamental human rights, essential for building a just and a prosperous Nigerian. And we also acknowledge that Nigerian women face unique challenges because me that I'm a woman, they face unique challenges from violence and harassment to discrimination and marginalization. And in view of that, we have determined that's why a lot has been done by the Inspector General of Police to protect and serve Nigerian women with dignity, to enforce all the laws, to engage with communities. That's what we do in police campaign against cultism and other vices. We carry out community engagement, and we also support survivors in a way that we are as far as we can go, as our job permits. But I just want to say that we cannot do this alone. We need the support of everybody, all Nigerians, both male and female. I need to quickly mention that it's not only men that perpetrate gender-based violence crimes against women. Some women too carry out this act, dastard act against fellow women and fellow same gender.
Yeah.
And that's why you see some people maltreat their house help and do other things to their juniors at work, workplace discriminate, sorry, intimidation, even to fellow women. So I'm calling on all stakeholders, let all hands be on deck. I'm calling on civil society organizations to support those of us that are directly charged with the responsibility of law enforcement, and traditional leaders too, who are the custodians of our culture. A lot needs to be done. And together, I believe that we can create a safer and a more empowered society for Nigerian women. Thank you.
Thank you, ma. Mrs. Ekene Shoba.
It is Shogbamu.
Mrs. Shoba.
Shogbamu.
So
Shogbamu.
Shobamu. Sorry.
Shogbamu, yes.
Shobamu.
Thank you.
Yes.
Yes. Sensitization will not end. We'll continue to talk and talk and talk. I will end with our NAFOA President's message for this year's International Women's Day. I will just take an excerpt from it. She said, accelerate action, empower her voice, ignite her rise. Equality is a journey, not a milestone. When women rise, the future shines. We continue to sensitize women that the future of the nation lies in their hands. So they should not keep quiet. Say something when they are not comfortable with an issue.
Yeah.
Culture should not be a barrier for you to come to this world to suffer. Rise, speak up, not only for yourself, for your children, for your grandchildren, for your generations unborn.
Yeah.
When we do this, and I feel that at the end of the day, we would have created a world that we all will be comfortable in. Thank you very much.
Thank you. Is Mariam still here? Okay. Dr. Olasi said she has something to
Please,
say.
I just answered your question straight to the point. I just want to, conclude, by saying that, as we reflect on the theme, that is safety first, equality always, I reaffirm NAPTIV's dedication to accelerating gender responsive actions that uphold the dignity, rights, and safety of every Nigerian woman. And in conclusion, I want to state categorically, without fear of contradiction, that safety and equality are not optional. They are the foundation of every just society. And by prioritizing both, that is safety and equality, we empower women to contribute fully, fostering a world where fairness and opportunities are accessible to all. And the time for action is now. So by prioritizing safety and equality, we can build a Nigeria where women can thrive without fear, intimidation, or discrimination. And I want to end by saying that when women rise, Nigeria prospers. And everybody should remember this old adage that says that the hands that rock the cradle rule the world. Educate a woman and you educate a whole nation. So together, we must ensure that equality is not just a principle, but a practice. Thank you very much. Yes.
Thank you. Thank you. I wanted to give an opportunity to our Chancellor, Athena, to speak. I've been trying to find him. If I don't know if our Chancellor can come in and say one last word. As we can see, Athena is very, 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 very women friendly, gender friendly. As you saw from the young ladies who read the comments and presented the results of the survey. So our Chancellor is here. 2 minutes. You're muted.
Okay, you caught me unawares.
I
I
know.
was just listening and enjoying this conversation, and it's it's a very interesting conversation. I've heard quite a bit today. I was even surprised more with the results of the survey, but I also like the passion and the energy in the room. So we're going to be doing an Athena perspective. We're going to write out some of the key points from this conversation and publish it as one of our newsletters. So I want to particularly thank Professor Cheluchi, NAPTIP, the police, and the NAFOA who are present here. Interestingly, most of the leadership are in New York for the women event. I think the NAFOA president is in New York. I also think the Minister of Women Affairs is in New York. So we've been going back and forth. But suffice it to say that the women issues are really important to us. We believe that women need safe spaces to walk in, safe spaces to move around, and that society should prioritize the safety of women, because that is the source of the growth of mankind. So that's what they say, the goose that lays the golden egg. Without the woman, then the future of mankind is in jeopardy. That's the way I look at the women issues. I look at it just beyond the tokenism of just saying, oh, we need to do this for women, just to think that all of us here are here by virtue of a woman. So thank you very much. And I hope that these conversations will continue, and I will continue to get all the stakeholders together. I just heard about the VAP reenactment. It's something we would like to follow through with NAPTIP and others to see that the necessary amendments to the law is made. Thank you very much, and looking forward to more conversation.
So I would like to thank everyone who participated in this conversation. It has been a pleasure on my part to moderate and host this conversation. As all of us saw, I almost don't feel like ending it, but we still have to go out and be the strong women that we are. So in addition to talking, we have to go out and continue to be the heroes that we are outside. I'm grateful to all of the women who have spoken today, and I look forward to more conversations in the future. Thank you very much, everyone, and God bless.
Thank you.
Thank you. Thank you for having us.
Thank you. Thank you.
Thank you. Thank you all. Nice meeting all of you.
Thank you.
Nice meeting you.
Thank you.
Thank you, Dr. Lassie.
Thank you.
Thank you.